Good morning, everyone, and welcome to Meet the Experts. My name is Amanda Pearson, and I'm a patient family specialist in the Patient Library and Welcome Center. We present these sessions each Tuesday and Wednesday at 10 a.m., and today's topic is on harnessing the power of the mind to relieve pain. Before we get started, we have a quick disclaimer. The content of this presentation is not intended to be medical advice, and the viewer should consult their physician should they have any questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs, and if you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. And never disregard professional medical advice or delay seeking care because of information in this presentation. And additionally, today's session is being recorded. We have turned off all cameras and muted microphones to better protect your privacy. If you have any questions, please use the Q&A tab and type your questions to our expert. And now it's my pleasure to introduce our speaker today, Sharen, Patient Wellness Coordinator in the Integrative Medicine Program here at Moffitt. She's been working at Moffitt since 2009, supporting patients and caregivers in finding greater ease in their body and mind through yoga therapy, meditation, mindfulness, and relaxation therapies. She enjoys making these mind-body therapies simpler and accessible so that anyone can participate at any point in their cancer experience. So with that, I'd like to welcome Sharen.
You for being here today, for joining, and thank you, Moffitt and the Patient Family Library, and Amanda especially for hosting the Meet the Experts. I've been really interested in mind-body health for over 25 years, and today we're going to talk a little bit about how we might use the power of the mind to relieve pain. So our time together will be, some experiential components as well as some education. So we'll do a couple of short practices along the way. Really practicing these techniques is the best way to learn. And at the end, we'll have a slightly longer guided practice. And then we'll weave in some resources at the end and hopefully leave some time for Q&A. So let's dive right in. So if you're not connecting by video, I do have a PowerPoint to share with you. So there are a few slides. So what is pain? So according to the National Institute of Health, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So I really want to highlight pain is an unpleasant experience that may not just be physical, but we can also have emotional pain, mental pain, even spiritual pain. And millions of people in the world live with pain on some level. And in fact, in the US alone, the CDC reports that about 21% of the population actually live with chronic pain, back pain actually being the most common. And pain is actually a reality for many folks that have had a cancer diagnosis. I think it's about 38% of people with cancer report moderate to severe pain to the extent that it affects their quality of life and just overall sense of well-being. So let's just pause before we go on to the next slide. Let's just take a pause for a moment and just kind of reflect on that probably everyone listening today has had some experience with pain. Probably everyone we know has some experience with pain, this unpleasant experience that can touch us in different ways. And to just kind of recognize our shared humanity with that sometimes we feel isolated and alone when we're going through difficult times, but really everyone has some kind of challenge, and it may be physical pain, but it may be other types of pain. So let's talk a little bit about, so you can move the slide on, Amanda. Yeah, managing cancer-related pain. So this is fairly complex, really requiring a toolbox of interventions. And in fact, the guidelines recommend what we call a multidisciplinary approach, meaning that it utilizes a combination of pharmacologic and non-pharmacologic modalities, many of which are shown in the box below. So we're never suggesting replacing a medical treatment for an alternative, thinking about it more as sort of utilizing the best of both and really complementing and integrating some of these non-pharmacologic modalities with standard medical care. So Moffitt offers most of these modalities through programs like social work, physical therapy, integrative medicine, pet therapy. There's support groups and chaplaincy, behavioral health. Many of these programs are actually offered virtual. And the ones that we're going to focus in on today will be the ones that are highlighted, how they really have a kind of a mind component. So, meditation, relaxation training, mindfulness, imagery, and visualization. So, you've probably heard of the mind body connection. And that simply means that our bodies respond to the way we feel, the way we think, and vice versa. So, one simple example would be that, our physical posture affects the quality of our breathing, and the quality of our breathing affects how we feel and how the nervous system is. So, thinking about everything being interconnected, and what we can learn is how to skillfully use the power of the mind to relieve some of the pain that we might be experiencing. And when we talk about skillfully, it doesn't mean that all these approaches are appropriate in every situation, just to apply a little bit of discernment that we may need to be selective about what practices will be most appropriate for any given situation. So moving on to the next slide. So talk a little bit about what we might think of as indirect mind-body practices. And this is where we use the mind and our imagination, perhaps, to focus away from the pain. You might think of this kind of as a healthy distraction, and there's lots of ways to do that. But most of the ones in the mind body approach are ones that activate the relaxation response, practices that help soothe the nervous system, calm and relax the body. And these are especially helpful when pain is more acute. You've probably done a pain scale where you're asked to report your pain level from 0 to 10. So, more of the moving attention away from pain is when pain levels may be, say, a 5, a 6, or a 7. Again, we're creating a healthy distraction. And we utilize some of the practices that are listed, especially with hospitalized patients at the bedside, people who've just, are in that recovery period from surgery, or in any period of time where pain is fairly high. So some of the techniques that we might use are things like guided imagery and visualization, some grounding techniques using our senses. There's an exercise where, name 5 things you can see, 4 things you can hear, 3 things you can touch. And so it's sort of bringing us into the present moment in a very specific way. And then things like breath counting or the repetition of a prayer. These are all practices that people have found very helpful for distracting away from the locus of pain itself. The last group of practices is just practices where we sort of warm the heart with reflecting on things that we might be grateful for, or savoring something that we really appreciate along the way. So we'll get to practice a few of these a little bit later on. So I just want to mention here that, when pain levels are at a 9 or a 10, usually these aren't the best practices. It usually requires a different kind of intervention, maybe a more pharmacological intervention. So let's move on to our first exercise. So if you're not able to see the screen, it's a large picture of 2 very bright, juicy lemons. And we're going to do a really simple exercise to demonstrate how we can use the power of the mind to create a certain effect So you can have your eyes open if you prefer, but you could also close your eyes or soften them. And it's just going to be a really brief exercise. But begin to imagine that you're holding a bright yellow, juicy lemon in the palm of your hand. Maybe feel its weight. Imagine its color. Maybe feel its texture. It's visualizing the lemon until perhaps you can sense, you can even smell its clean smell, its tartness. You might imagine cutting into the lemon, cutting a slice, and just imagining the edge of the knife, just gently breaking the skin and releasing a fine, fresh mist. Just noticing that fragrance. And then you might imagine even biting into the lemon. You can open your eyes. So what have we just done? We've actually activated a very real physiological response simply by using our imagination. These types of practices are usually a little bit longer, but they help the nervous system kind of settle. So they generally slow our heart rate down, our breathing rate, muscles tend to relax, and perhaps we can feel, just kind of can access a feeling of being calmer, maybe more refreshed, maybe more focused. So other examples, this was a very kind of short experience, but you might imagine yourself in a peaceful place. Um, when you go to the dentist, they say things like, oh, go to your happy place. So this will be a more expanded version of that, where we can use imagery and visualization to create a very specific response. So let's move on from here and talk about another set of practices. So these are more direct ways to use the mind, and perhaps more useful when there's perhaps more ongoing pain, chronic pain, maybe when the pain is maybe a 2, a 3, a 4. And it might seem counterintuitive, but in these practices, we actually turn towards the pain or the discomfort or the unpleasantness. So the psychologist Carl Jung has this phrase, what we resist persists. So we do have a tendency to want to avoid being in pain. And yet sometimes by resisting and suppressing our experience, we can actually create more tension and stress and distress and suffering. So with these more direct mind-body practices, we're actually learning how to build resilience, to build the capacity to sort of be with the pain, perhaps in a more skillful way. And in these set of practices, they use the breath and body-based practices to kind of reconnect with sensations in the body. So we have the word pain or discomfort, but it doesn't really describe what the sensation is. So one approach is to develop what we call a language of sensation, replacing or reframing the word itself, pain, to, tingling, aching, stabbing, numbness, maybe thinking about the pain having a size, a shape, a color, noticing if it changes, is it constant? And so we kind of develop more of a language of sensation that can be skillful. And then, just touch. So sometimes when we're struggling, just a hand on the body has a very settling, calming effect on our nervous system. So the last point is noticing perhaps how we relate to pain. We'll just move on to the next slide. We could spend a lot of time on this, but just in simple terms, we can think about primary and secondary pain. So the primary pain is that unavoidable part of life, that unpleasant experience, the pain itself, the sensations of discomfort. And then on the secondary level, it's actually how the mind responds to that, how we relate to it. What are the kind of thoughts and emotions and stories that we have around the pain? So we might use an example perhaps of chronic back pain. Maybe you wake up one morning and it's flared up, and there's the real discomfort of that sensation in the back. And excuse me here. And in addition to that, we might add, thoughts like, oh, how long is this going to last? Am I going to have to cancel my plans for the weekend? How long am I going to have to take medications? Is there going to be side effects of the medications? So sometimes what we add to the pain is kind of a secondary level of suffering. And we can learn how to sort of separate those components so that we might have different practices to address the painful sensations, but also other practices to relate the stress and the emotional distress around the pain. And, this is definitely a practice to approach with some curiosity and compassion. Let's move to the next slide. And there's been really a lot of research on self-compassion when we're experiencing difficulties. Self-compassion just means the capacity to relate to our struggles, our difficulties, our pain with greater understanding and tenderness. Often we're much kinder and understanding when a friend is going through a difficult time than we are for ourselves. And we can actually kind of feed into the distress that we're already feeling by having a lot of self-judgmental thoughts about what we're experiencing. Dr. Wolf says, and there's a reference of hers at the end of the resources at the end, she says, we practice compassion not to make the pain go away, but because we are in pain. So let's move to our second exercise. If you're not able to see the screen, it's a visual of someone with a tight fist, so making a tight fist with the hand. So let's try that. So invite you, if you're comfortable, just to bring one hand up and just make a tight fist with that hand. And you can even close your eyes if you're more comfortable. And I'm going to invite you to just kind of explore that for a moment. So just notice what happens when you do that, when you make a tight fist. Does your breath change? Has your breath become more restricted? Maybe you feel like you're holding your breath a little bit. What's happening in other areas of the body? Have other areas of your body tensed up? And we'll just begin to relax the fist and just release. So notice what that was like. We're going to do it a second time a little differently. So make that fist, squeeze it tightly, maybe soften your gaze, feel the sensations in the hand, and then start to imagine or feel that you're directing your breath into the fist, breathing into it. And just notice what happens when you do that. When you breathe gently into the fist, do you notice it begins to soften a bit? Does your body begin to relax a little bit? You could even add just kind of covering the hand with your other hand, just kind of soothing that tension. And then releasing just for a moment. So 2 examples. Let's move on to the next slide. So sometimes when we feel pain, we actually tense the whole body up around the pain. And we have a tendency to inhibit or restrict the way we breathe. So the quote here, imaginatively directing your breathing toward the pain naturally undermines the habit of inhibiting or restricting the breath. This is key here. The primary pain may not change, but as you relax, the secondary layers of tension and resistance can begin to dissolve. And we do find that when we work with, folks at Moffitt, we notice when we do our scales and we measure pain and distress that often pain doesn't always change too much, but the emotional distress and the physical distress that we measure does really dissipate. So, it's really a great approach to think about, when we're in pain, can we relax around it and use the breath? So the fist can be a metaphor for the physical pain. So let's do a slightly longer practice. Thank you, Amanda. I'm going to lead probably a 5-minute practice, and we're going to pull in some of these different techniques and tools. And so if you're able to, find a really comfortable posture to do this, it will be fairly brief. So go ahead and shift into any comfortable position. You have the option. So there's a beautiful visual on the screen of the lotus flower. You can, rest your gaze on that if that's soothing. You might also experiment with softening your gaze or closing your eyes. And just take a moment to kind of connect with the sensations of being in the physical space that you're in. So you might notice sounds, temperature of the air, maybe any scent in the air. And just using your senses to orient into the present moment, wherever you are. And then practice a little grounding by feeling the weight of your body kind of rooting downwards into your chair. Just feeling the effects of gravity sort of pulling the weight down. And if you are sat in the chair, perhaps bringing awareness to the bottoms of your feet and just kind of feel them pressing into the ground, creating a little bit of stability, feeling of being anchored and present in your body, in your present moment experience. And then you might take several slower, deeper breaths in and out. Just take your time gently. And as you do that, just begin to relax and soften from the top of your head all the way down to your toes. Particularly around the eyes, the jaw, neck and shoulders, the chest and the abdomen, even the hands. And then bring awareness to any area of your body that feels comfortable and at ease. So it might be your hands or your lips or just feeling the air against your face. And then let's just practice shifting our attention to any area in the body that might be experiencing a little bit of discomfort. Just gently moving your attention towards this area. We have the word pain or discomfort, but what is that really? Let's begin to notice the actual sensations. Do you feel some heat, a tightness, a sharpness? Do the sensations have a center? What are the edges like? Is the sensation solid? Maybe there are spaces inside the sensation. Perhaps you're aware of thoughts and feelings, any stories associated with those sensations. And if at any point it becomes overwhelming, you can just shift your attention back to the breath or the area of the body that you identified as feeling at ease. And now imagining that you can direct your breath right into that sensation in the body. Sending your breath directly into that area, inviting it to soften, to relax, maybe to release a little bit. As you breathe into sensation, just breathe in kindness and care for whatever experience you're having. You do that, perhaps feel that your whole body begins to relax a little bit more. Or maybe the sensation shift a bit. You might get slightly less intense. Just noticing that. Just bringing some curiosity and kindness into the experience. You might even rest a hand against this area. So you give it your care, your support, your nurturance. And then taking a moment to just reflect and savor something that's positive in your life. So just kind of switching gears a little bit. So maybe something from the natural world, maybe a recent connection with someone, a cuddle with a pet, a recent situation that felt sort of positive that you can just savor. And just let that reflection really soak in. So use the kind of metaphor of the rain soaking into soil. We want to let that feeling of sort of appreciation just soak into ourselves. Perhaps feeling a little more comfortable, more centered, a little more present, a little more hopeful about the future. And then perhaps just sending out your positive and warm wishes for all living beings to experience peace, good health, and freedom from pain and distress. Just notice what that feels like, just to reflect on kind of a universal wish for all beings to be free from pain and suffering. You might wiggle your toes, your eyes are closed. Open the eyes. So that was about a 6 or 7 minute practice. We kind of moved through quite a few of the techniques that we've been covering this morning. So let's move on to the next slide. So in our integrative medicine program, we have a number of services that, improve folks' quality of life and well-being and help with managing pain. So we have an oncology massage program, we have an acupuncture program, we have a yoga program and a meditation program. So if you're interested in those services, you can reach out with the information below on the website or emailing us. And then moving to the next slide. Every Wednesday, we host on Zoom a virtual relaxation and meditation session. That's a 45-minute session. You can register online at moffitt.org/meditation. Everyone's welcome. In fact, family members are also welcome. And moving to the next slide are some instructions. When you click on moffitt.org/meditation, you'll see a calendar. You can sign up, and then we will receive your email, and then we'll send you a Zoom link. So if you're interested in practicing more, kind of what we did this morning, you may want to sign up for these classes and drop in whenever you can. Let's move on to the next slide. Several resources. Feel free to take a snapshot with your phone. There's a lot of resources out here. I just picked a few books, some meditation apps, and a website that's, if you're particularly interested in guided imagery and visualization, healthjourneys.com is a fabulous resource. Some of the authors of these books also have YouTube videos and really offer good free educational and experiential material. So there's lots out there to utilize. And then moving on. So thank you for joining. I hope you found benefit from the information provided. You can reach me. There's my phone number and email address here.